Thank you, Madam President. I appreciate the opportunity to respond in much of what my colleague had to say about we are in the middle of a pandemic. Families are struggling. Yes, indeed. That is very true. And if you want to talk about making health care services more available to more women, then yes, indeed. What you want to do is make certain that these taxpayer funds are not used to provide abortion services, that these funds are going to the community clinics that are the ones that are providing the screenings. Many of the Planned Parenthood clinics do abortion. They refer women to the community clinic around the corner for the cancer screenings, for the breast exams, for the pap smears. So there should be agreement that yes, individuals should have access to this health care. And if you say, if you perform abortions, you cannot have these Title X dollars, then the hundreds of community clinics that are access points to health care for women in underserved communities, these funds would be made available to them. Madam President, I think we also have to talk about rights and privileges and touch on that for just a moment. And I fully appreciate we all have different opinions, and it is wonderful that we live in a country that allows freedom of speech, where we can express our difference of opinions. What we do have to realize is this, that we have in this country 1,700 lives lost every day to abortion, 1,700. Voiceless and vulnerable. And to me, that is just an absolutely heartbreaking stat, that these unborn children do not have the opportunity to enjoy that right to life. I find that very sad. As I said, this legislation would make certain that all of this money goes to these health clinics, but not to a clinic that provides abortion service. This is the kind of access that, yes, indeed, many families would appreciate having more access and more services available to women at their community clinics.